I'm not so good at staying stable when I'm giving a talk, but I'll try my best. We've heard a lot of definitions of social entrepreneurship today, and I think social entrepreneurs, we are good at getting ourselves in trouble. I think we look at the world, and when we see a challenge, we take ownership of it and we make it our everyday problem to tackle. And just like the example we saw from Peak, if we want to really understand these problems and find the reasons and how we can solve them, we should start with the people who are in the center of these challenges. I'm a designer, and I include communities in the creative processes. I think it's everyone's right to have a say in the changes that we are trying to create. Including people in designing the changes can take part in all phases of creativity. This starts with finding the need, it continues with finding the ideas and solutions and building together with people. And even in the implementation, we should invite everyone's collaboration. And I would like to show you a couple of examples from different phases with different projects. The time when I first understood the value of including the users in finding the need was when I did a project with Index and UNICEF. So in that project, UNICEF identified a problem in the primary schools that they worked in. The soap that was provided to schools was getting lost and melt away all the time. So the challenge that they asked the designers to work on was, how can we have a soap holder which would keep the soap in place and maintain hygiene in the schools? When you look at this problem from the schools and UNICEF's perspective, it's a direct need. But when you look at it from a student's perspective, the story is different. Only 7% of school kids wash their hands at school. This happens whether there's soap or not. So even if when we provide the soap there, it doesn't mean the hygiene is going to improve. So when we ask the students the reasons of why they don't wash their hands, it's because hand washing is boring. Hand washing takes time from the break time that they could play with their friends, and it's something they have to do alone. So when I realized this problem, I decided to turn hand washing into a playful experience, as well as keeping the soap in place and providing it at all times. So the inspiration was an abacus where the children could play with the soap. And really back then I wasn't so experienced, but when we put it in the schools, the test was quite fun for me to watch. This is how the children were. So this was without no instructions, and really I was so careful about how to put the soap there, and then the break time, all the students came there and started playing with it, and this was the message I got when I was a student. Every need has to be identified. Even when we learn about a need, we have to really dig into these problems to find the real cause. It's not enough to just include the users in the need finding, but it's also important to develop the ideas and by testing with them and getting their feedback. In the example that I'll give on the idea generation, I'll give you a little bit of background information. I'm working at Lardal Global Health. We are a non-profit company, and our aim is to help save lives of mothers and babies at birth in the low-resource settings. And we work a lot with healthcare workers. We design both products and programs to train them on life-saving skills. Some of the programs we have are helping babies breathe right after birth and helping mothers survive by stopping the bleeding. And today, our focus is on premature babies. Premature babies are born earlier than normal, and they are one in 10 baby worldwide. And they make up of a big amount of the babies who die during the first month of their lives. And the care that is provided for the premature babies can be simplified into something called kangaroo mother care. In the kangaroo care, the baby is held skin to skin to provide the thermal control for these babies who don't have enough fat in their body to protect the heat in the body. The second is providing them with breast milk and to protect them from infection. So this is quite an affordable, low-cost method, but it hasn't scaled up to its full potential. And the full potential is to save half a million lives, 500,000 babies' lives with kangaroo care. So we looked at the challenges of implementing kangaroo care, and one of them is that the mothers have problems with tying the baby on the body. Not only tying, but keeping the baby on the body at all times to protect them with the heat control. So we started to design a way to hold the baby on the body, on the chest of the parent. So this is what I call an idea generation map. When you start a project, when you identify a need and start to generate solutions, you first develop a number of solutions, a number of ideas, which probably is not going to work. And then you slowly eliminate some of them. You take them to the field, test with people. Then you create more alternatives, and then you start to focus on finding the right solution. And here, every circle is a prototype, is an idea, and every circle asks a question. One is asking about the materials, other one is the tying methods. And today I would like to take you to Malawi and Tanzania, where I was last August, and where we tested some of our prototypes. This is a typical kangaroo room in Malawi. There are 3 beds. How many? There are 6. 6 mothers sharing 3 beds. And none of them are really holding the baby fully on the skin for long hours. So when you come in a place like this as a designer and you're really excited to test your ideas, it's quite important to start a little casual. These are mothers who are quite vulnerable. They just had a baby who needs to be taken care of. So it's quite important to build trust. You just ask questions. How many children do you have? How do you feel today? What is the baby's name? And after that, you can't just simply talk about ideas. You have to have people try these solutions and give feedback. And sometimes we can help the users give feedback by offering them a couple of options. Because what we want is for them to give us comparative feedback. We want to open discussions and compare different features of prototypes. We don't want positive feedback from them. This is an easier way to open discussions and understand how the different ways of wearing, like in this case, we were trying to identify whether wearing from over the head or on the arms was more preferred by the people. This is a way to make them use different alternatives and give feedback, but that's not enough either. We have to allow some time for the usage, because sometimes the first impression might be different than a longer time usage. So here, what we did in Tanzania and Malawi, we gave the different prototypes, and we left it for the women to use. They could use it, they could wash it, they could sleep with it, they could wear with their other clothes. And afterwards, we could have a much thorough discussion on how it impacted their daily lives. And it's also quite important to collaborate with the healthcare workers. They are the persons who are usually in much closer contact with the mother or the whoever patient there is in a situation like that. And the reason we are doing this is to fail early. We want to make all these mistakes as early as possible and fix them as soon as possible. And here is me with my teammate from India working in a hotel room trying to fix all these mistakes we did. And obviously we didn't know about it when we were designing them. So including the users in the design process helps us really understand why we are designing this product and how it's going to take place in the daily life of people. We can make all the mistakes we want in this process, but when it comes to implementation, we still have to understand the people. I talked about something called Kangaroo Care. Many people in Malawi have never seen a kangaroo in their lives. So in the hospitals, in the kangaroo rooms, there are pictures of kangaroos, which shows why this is called a kangaroo care, why the baby is put in skin-to-skin contact. But in the local language, the word kagaru means a small dog. Yeah, unfortunately, because even when the mothers learn this in the hospital, when they go back home, the people who heard about the term kangaroo, they think it's similar to a small dog. So actually, many mothers were complaining that they were being mocked, they were being teased about their babies, and there was a lot of prejudice about taking the baby out of the house. This is something that you wouldn't know if you don't look into the culture before implementation. You have to really understand what symbols, colors, or even words make meanings in different languages. So in this case, we knew that we couldn't name this product Kangaroo something because we learned this. So even it affected the name to become Care Plus. This is a home setting where the Care Plus could be used. And this is exactly where your products are going to take place. So it's important to look at the daily life of the people before implementing the solutions. But moreover, it's just extremely fun to work with people. It's really fun to go out of your design office or studio and take the whole process from beginning till the end, and there is no end, obviously, in the field together with the people. And before this project, before I started working at Laerdal Global Health, I was living in Uganda, and many of my friends here, they know me with a project called Happy Baby. And I want to show a video from Happy Baby because Happy Baby was also a baby carrier, but from newborn to very big babies. And we had a lot of focus on including fathers in the baby carrying. So here is a video of our implementation and how we had to really have fun with the people as well as doing the project. been hearing a lot of examples from Africa today, but just to make it clear, field work is not only low resource settings. It can be anywhere. Even in this very room, we could improve so many things. And wherever we are working at, and whoever we are working for, we should really collaborate with the people who are who are really experiencing the challenges that they're having. Thank you so much.